Welcome. I'm Dr. David Basil, Vice President of Clinical Quality for Vera Medical Group. Joining me, Dr. Mike Wilde, Vice President Medical Officer for Sanford. Thank you for joining us for a COVID update today. You've heard Dr. Wilde, myself, others talk about COVID quite a few times over the last several months. We've talked about how busy the hospital is, how stressed our staff are. Now COVID has come to town, and it's really elevated the pandemic to a whole new level. The reproduction or spread rate is running about 1.6 right now with the Vera's numbers, which is the highest number we've seen throughout the entire pandemic. The number of positive tests that we are seeing on a daily basis is about 1.5 to 2 times the level we even saw at the peak of 2020 in the fall. The positivity rate that at its peak during the fall of 2020 was in the upper 20s is now in the upper 30s. So Omicron is just taking off just incredibly fast. Delta, it's shoved Delta to the side, and there's almost no Delta around because Omicron just totally outcompeted it. Now there is some good news to be had. You've probably seen in the national media that Omicron appears to be a little bit less severe than Delta and previous strains, and indeed that's what we've seen with our numbers as well. The hospitalization rate is lower, maybe half or even less compared to Delta. Unfortunately, the sky-high number of cases, on average, our hospitalizations continue up at a very steep rate. You know, all of December, we were kind of gradually increasing, and we actually, at Vera system-wide, we saw a little bit of a decline in hospitalizations in the second half of December. About the first of the year, we had a little under 100 patients in the hospital system-wide at Vera with COVID. Now, in just a little over 2 weeks' time span, we've more than doubled our hospitalizations to over 200. We were already busy. We've been telling you that through all of December, and now our COVID numbers in the hospital have doubled from that. We are making harder and harder choices every day, and those choices get harder every day as those numbers go up. For every patient that we discharge, or unfortunately way too often that dies and opens up a bed, we are having to choose between multiple patients on who is the sickest and prioritize who can be put into that bed. And those decisions get harder each and every day. We continue to see a rise in the flu cases, again adding to the hospitalization burden. And we're still seeing heart attacks, strokes, trauma that have to be seen. These COVID patients continue to be sicker than what we see with influenza or other types of pneumonia. They have a longer length of stay. They require more resources to care for. We particularly see a difference between our vaccinated patients and our unvaccinated or non-boosted patients. As we look at the patients in the hospital right now, 84% of them are either unvaccinated or not boosted. So only 16% of them are fully vaccinated and boosted. Those ones that are breakthrough for the fully vaccinated and boosted population tend to be older, sicker at baseline. Those ones that are unvaccinated, we see a lot of patients now that are being admitted in their 20s and 30s that are very sick. So 84% either unvaccinated or not fully boosted. Close to 90% of those in the ICU are either unvaccinated or not fully boosted. 100% of our ventilator patients are unvaccinated or not fully boosted right now. It's not just the hospital that's being stretched right now. Because of that high number of cases like we've really never seen before, it's stressing our urgent care centers, our EDs, and our clinics. It's particularly stressing some of our testing locations and our testing supplies. At one point when Omicron first hit, we were using more than twice the daily supplies of testing kits of what we get allocated on a federal basis. We've been able to kind of readjust, bring on some additional testing platforms and get that back under control, but we are chewing through tests at a higher rate than at any other time during the pandemic. Staffing continues to be one of our biggest concerns. We have literally hundreds of staff out on a daily basis, either with COVID or recovering from COVID or exposed to COVID. Those numbers continue to be high. The CDC's decrease in 10 days to 5 days on isolation has helped us get some of those workers back sooner, so that's definitely been a plus for our workforce, as many of the other businesses' workforces that we're seeing. But the staff are stressed. They are seeing ever more acuity, sickness, pain, death. At the same time, we are redeploying clinical staff from non-clinical roles, managers, quality staff, population health nurses, bringing those into more clinical roles where it makes sense. We've been down this road before. We've got battle-tested surge plans, and we're putting those into place. We are evaluating daily on surgical cases, especially ones that require overnight beds, and the urgency of those. Can those be delayed until after this surge happens? And so the number of cases that we're doing are considerably lower as we try to open up those beds for COVID patients. Another lever that we've been pulling that's really been helping out is innovative program through Avera at Home called the COVID Care Transitions. We are caring for almost 800 patients right now through a combination of home nursing visits, phone calls, video visits, telemetry, oximetry at home, including over 130 patients that are on home oxygen with COVID, that most of those otherwise would have had to be admitted to the hospital. And frankly, I don't know where we would have put them. And so we are very thankful for the advancement of science that's allowed us to do that safely and effectively. Treatments is also a mixed bag right now. Some of the treatments that you've heard about throughout the pandemic are no longer effective, particularly Regeneron and bamlanivimab monoclonal antibodies are no longer effective against the new variant Omicron, so we can't use those. We still have sotruvimab, which is a monoclonal antibody that is effective. We also have some new agents, so some good news on there. We have 2 new oral agents that can be used. We have Paxlovid and we have molnupiravir. And then we have one other IM agent that has been used in the hospital for quite some time, but now the studies show is effective in preventing hospitalization in moderate to high complexity patients. And that's remdesivir, which you may have heard about. And so we're using that more now to prevent hospitalization, whereas before that was just once you were hospitalized to prevent you from becoming sicker. The main limitation of all of these agents is supply, particularly Paxlovid and sotruvimab, very limited in supply. Remdesivir has plenty of supply, but the biggest problem is it requires 3 daily injections, and so having the infusion center capacity to be able to handle that load. And so all of these agents are really prioritized for those most at risk, so the immunosuppressed, immunocompromised individuals, those who have multiple chronic illnesses that put them at risk from COVID, chronic heart and lung disease, chronic kidney disease, those sorts of items. As important as what we do give for therapeutics, it's equally important on what we do not give. We continue to follow the current science and guidelines of what the studies show are effective against COVID. There are multiple compounds out there that have been shown to be effective in a petri dish to kill COVID if given in high enough concentration. It seems like every day in the news we read about a new one, whether that's hydroxychloroquine, ivermectin, marijuana, Benadryl, milk protein, bleach. A lot of things, thousands of agents can kill COVID and other viruses on a petri dish. The key is, can you get it into the lungs and through the rest of the body in a high enough concentration to still be able to kill COVID without killing all the healthy cells around there? Unfortunately, pretty much none of those agents are panning out of being able to do so. And so we continue to urge patients not to take over-the-counter or or agricultural use things like ivermectin, because they just have not been shown to be effective. We do have limited supplies of some that have been shown, and we will continue to use those to the best of our ability. So painted a little bit of a picture of what we're seeing here. There is some hope here. We've been down this road before. We do have those battle-tested surge plans. We're implementing those. We will continue to handle whatever COVID throws at us, but we need the public's help. We need their help in several ways. First off, vaccination. I talked about this before, but with Omicron more than ever before, it's important to go out. If you've already been vaccinated, get your booster. With Delta, the primary series alone still was being effective about 60% of the time, and booster would help some to get you back up to like 80-90% effectiveness. But with Omicron, that primary series alone is only about 30% effective. You really need to get that booster to bump you back up to 70-80% effectiveness. And so if you have been holding off thinking that you were going to be able to get through without getting your booster, now is the time to get it. We have plenty of vaccine supply. If you want a booster, we will figure out a way to get it to you. Individuals 5 years of age and up can get the primary series at this point. Individuals 12 and older can get and should get the booster. The 5 to 11-year-old range hasn't been approved more than 5 months now, so they're not eligible for boosters. So probably February, March timeframe, we'll start talking about boosters in those younger age groups. And sometimes we get asked, what about that 2 to 4 year age range? Are we going to see that get approved at some point? And unfortunately, the initial studies in that age range with the 2 doses 3 weeks apart had not shown a high enough antibody level to be protective in those youngest patients. And so they had to go back to the studies, and they're looking at what if we stretch out to more like 6 or 8 weeks to get that second shot, or what if we give a third shot? Will that boost up the levels enough to be protective? So it's going to take a few months for those studies to get completed. So we're probably looking April or May before we're going to have any lower age range vaccinations available. So first and probably most importantly, vaccinations and boosters particularly for Omicron. 2, Omicron tends to be a little bit more upper respiratory symptoms even than Delta was, and there's even more overlap with common cold symptoms. So any degree of runny nose, sore throat, nausea, vomiting, diarrhea, fevers, chills, any of those symptoms, we're running close to half of those turning positive for Omicron right now. So even though you may feel well enough to go to work or go to school, stay home, get yourself tested. Dr. Wilde is going to talk more about testing and how that can be accomplished here in a little bit, but that is so critical. Omicron spreads so much faster than Delta did or than the original strain did that it's even more important to stay home and get yourself tested. Third is the usual mitigation strategies of social isolation, masking, which I think Dr. Wilde is also going to talk about. So vaccinations, stay home if you're sick, get tested, and the usual mitigation. So I'll finish again with some hope. We've seen in other parts of the world, other states, that Omicron comes on hard, but then levels out and comes back down again. There is some light at the end of the tunnel that we will, come spring, be in a lot better place than what we are now. We've been down this road before as hospitals and health systems. We can get there, but we need your help to cross that finish line. Hang with us a little bit longer, dig in, do more than ever before, and we can get there together. So with that, I will turn it over to Dr. Wilde, Vice President of Medical Operations. Thank you.
Thanks, Dr. Basil. Good afternoon, everyone. We've been dealing with COVID pandemic for nearly 2 years. As healthcare providers, we continue to need your help. While many are minimally directly affected by COVID, in the hospital we see those that are greatly affected. I recently worked some hospitalist shifts and admitted COVID patients within the past week. One in particular, as most of them that come in with illness due to COVID, we're very accustomed to working with patients who have bad luck, run into issues, whatever. And so just for the sake of the science, we ask about vaccination, but it tends to be a very collegial, constructive conversation. And the patients, and we've had a commercial out by one of our pulmonary nurses, and I think it's a very telling commercial. I think it's very accurate of what we see on a daily basis and what I saw. It prompted a conversation with another physician that was caring for this patient, and we both realized, and it made me realize how little people probably see of COVID in the hospital. We see it every day, and we see it in some very bad ways. And it dawned on me that not a lot of people have seen this because we've been limiting visitation throughout the pandemic, and we now allow visitation within COVID units, but there's not a lot of people that have seen it, and it's very dramatic, and these folks are very ill and had been very healthy, and really kind of sit there and just wonder, what the heck is going on? It's very impressive how ill people can get with this. And so we need you to get vaccinated. We need you to get your booster shot. Those simple, unselfish actions will greatly diminish your chances of getting COVID and having to go to the hospital or giving COVID to a vulnerable person who may need hospitalization. This will help the strain on our hospitals and healthcare workers. The COVID-19 vaccine is working, and it's working extremely well. It is effective at preventing serious illness and hospitalizations. Across our Sanford Health footprint, we have administered nearly 600,000 COVID-19 vaccines since the vaccine was rolled out in December of 2020. Right now, close to 90% of our patients in the hospital with COVID-19 are unvaccinated. Once again, we're seeing our hospitals reach a very high census. That includes both COVID and non-COVID patients. This is very challenging for all of us working in healthcare. We strive daily to provide quality, safe care and a good experience. With the numbers of patients we are seeing, we have to prioritize those with the greatest needs, and Dr. Basil spoke to this as well. We want to provide quality care for all in the moment. That's why we're here. It's very stressful for all of us when we cannot do that. For some, you may have noticed COVID-19 test results are taking slightly longer to come back. This is because our laboratory teams are running thousands of tests every day, around the clock, running 24 hours. We have also been challenged by staffing shortages with the national supply companies, in addition to weather concerns of late as well. Our drive-through site is averaging between 500 and 700 tests per day. There are in-home tests available. They're becoming more widely available. Fortunately, in the upper Midwest, we've had a pretty good supply of these. If you test positive with an at-home test, consider that a positive test. They are accurate. I would absolutely consider if you have symptoms, you test positive, you are positive. You don't need a confirmatory test to confirm that infection. That will take some pressure off our laboratory team and prevent you from having to wait in line to get tested or wait for up to 48 hours to get those results back. We are also asking you not to come to the emergency department just for the sake of getting tested. Again, home tests are available. Those places are for people with life-threatening conditions. We continue to emphasize protecting yourself. Get vaccinated and boosted. The CDC now recommends masking with the highest quality mask available. We ask you to take the steps to best protect yourself and those around you. Our healthcare workers are not immune to the virus. In the last week, we have had hundreds of clinical staff unable to work because they are ill with COVID. Due to the Omicron surge, in addition to many others who have had to call in sick because their child care centers are closed due to COVID. This is an urgent situation. We're doing everything we can to prevent a workforce shortage, to make sure that we can be there for our communities who rely on us in their greatest time of need. A big part of that is making sure that our communities do their part to support our healthcare workers, who are now in their fourth and largest surge of the pandemic. The best way to support our nurses and frontline providers is get vaccinated and boosted. I would also ask our communities for their patience and kindness with our healthcare teams who are feeling significant stress and burnout. It is a daily stress for all, with hope for the future, but know we must continue to work hard and prepare for future challenges. So thank you, and with that, I'm happy to take questions, Dr. Basil and myself.
For whichever one, I suppose, I've seen reports, and people have asked me as well about reports they've seen saying Omicron, or the patterns Omicron has, are often sort of the things you see as a pandemic ends or in the later stages of a pandemic. Is there any accuracy to that, or is it a little more complicated along those lines?
So the question was with Omicron, and I'll put a little words in your mouth and correct me if I'm wrong, but with how aggressively that spreads but yet causes mild illness, maybe that's a sign, as with in other pandemics, that it's the end of this pandemic. That's certainly our hope. I think the reality is, as you look at science, as you look at viruses and living creatures, I think we will be dealing with this throughout our society for the foreseeable future, hopefully in much lower numbers. I think Omicron, you know, I've never been through a pandemic, so I can't speak from experience, and in fact, most people researching this have not either. So you kind of have to look back in history a little bit, but viruses do this. They're, as we've talked about before, they're going to try to spread, and whatever gives them that advantage, they're gonna do that, and that's gonna be favored, if you will. And so Omicron and viruses like that, what we look for really with variants is, do they escape immunity? Do they cause more serious illness? And do they propagate more? Omicron seems to propagate more, has a little bit of an escape in the immunity, fortunately not causing more serious illness like Dr. Basil alluded to in terms of hospitalization. So it'll be interesting for the future what that holds, but we do know that, and I've said this before, the more immunity we have through boosters, through vaccines, the less virus that's circulating and the less variability or chance for variability there will be with that virus.
I would ask about, you mentioned how busy it is. If I were to have a heart attack and go to the hospital, or if a kid comes in with a broken leg or a broken arm, can you kind of paint a picture for people that might be the only time they actually get into a hospital when they need something like that?
So that's actually an excellent question. And one of the kind of unspoken tragedies that happened during the pandemic, especially early on in the pandemic, people were really scared to come into the hospital. And we saw a change in folks that were having heart attack and stroke symptoms particularly, whereas before they would come on at the first sign of chest pain or the first degree of numbness or weakness, that started coming in a couple days later where they had a completed heart attack or a completed stroke and there was nothing we could do about it, whereas before we could have given them some clot busters and probably reversed some of that damage. And so one important point to make to the public is that if you do have medical emergencies, if you have chest pain, if you have stroke symptoms, any of those true emergency things, absolutely come in. We will get you taken care of. We will find a place to put you, and we will make sure that we do what we need to do. What we are asking the public to help with is to decrease the number of COVID that's coming in by doing everything they can so that we continue to have that ability and that we're not burning out our staff doing so.
Along those lines of talking about the Omicron and how fast spread it is, maybe we've heard the word endemic come up. How long is it going to be before we get to that endemic, and how much does herd immunity, how far out are we from herd immunity when you have over 60% boosted or at least vaccinated, and you've had who knows what the population that has had COVID?
Yeah, so the question is really around with Omicron, how rapidly it spreads, and how far away are we from this becoming more endemic and lower numbers and about herd immunity. And the quick answer is I don't know. The projection I would have is that, and it's kind of like the last answer I gave, is there will still be vulnerability within our population at all times, because we do see breakthrough infections with Omicron and with the other variants as well. Omicron perhaps a bit more, but the less it circulates, the less chance that's going to be. The hope, as we look at the world, for instance, first described in South Africa, but probably did not originate there. So you look at Africa, you look at Europe, those numbers are starting to come down. The Northeast is starting to come down. So the hope would be, as we progress into spring, and so the next couple of months, we would see lower numbers, still occasional cases of COVID, but at a much lower number. Just like we see, say, with influenza or RSV, you might see some peaks and troughs from time to time, but to me, that's what the virus going forward would look like, barring any other variants out there and things like that. In the ideal world, if we're all vaccinated or have immunity and the virus is no longer circulating, it's gone. I don't foresee that in the immediate future.
I don't know if this is a better question directed at, but you've talked a little bit about the natural immunity, the breakthrough infections. What kind of are you seeing people who had COVID before get it again? And can you talk about that in terms of like people who are vaccinated versus unvaccinated, and just what you're seeing in the trend there?
So the question is, are we seeing a lot of reinfection, and what are the characteristics of that reinfection right now? We've all seen the sphere that is COVID with the little spike proteins off it. Pretty much all immunity is directed against those spike proteins, whether that's natural immunity from getting infected before, whether that's vaccine-induced immunity. Those antibodies bind to that spike protein, inactivate it, and allow the body to clear that off. With Omicron, that spike protein is mutated enough that those antibodies don't stick to it as well as they did before. And you need a high enough concentration of antibodies so that if one pops off, another one is right there to pop on to keep it inactivated so it can't enter the cell and go there. And so that's why we are seeing so much reinfection in those that had, say, Delta naturally before, or those that just have had the primary series of vaccination, is that there's not enough antibodies nearby there to overcome those mutations and the less stickiness of that spike protein to the antibodies. And so that's why it is so important to get your booster. And that's why we are seeing reinfections in those individuals that just had their primary and not their booster, or those that have been previously infected with Delta or the original virus. And those tend to be in younger 20s and 30-year-olds. We're seeing it in that population. We never did, initially that first year, or at least rarely did.
Could you clarify one more time, like the timetable when it's safe to leave your house, go back to work? Is that from time of symptoms to testing positive?
Right. So the CDC has changed their recommendations for Omicron, mainly because Omicron is a little bit different in its time scale. Because it spreads so much more rapidly, it actually escalates in the body a lot quicker. And so the period of time from exposure before you start having symptoms has been shortened from 4 to 5 days down to 2 to 3 days. And you also clear it on the other end a little bit quicker, down to kind of that 2 or 3 day time period. So the official CDC recommendations now are that if your symptoms are improving, if you are no longer febrile, and you're well on your way to recovery, it's no longer 10 days, it's now 5 days before you can go back out in the public wearing a mask. And so that has been very helpful for all of our workforces, those sorts of things. Now, if you're in the hospital setting, hospitalized individuals are not clearing COVID as fast, and so at least at Avera, we're still keeping it at 10 days of isolation there, and I believe Sanford's the same. But in the community setting, it's down to 5 days of isolation plus another 5 days of very conscientious masking.
When you're talking about reinfection, like earlier, when you look at people who are asking question, is natural immunity as good as or more effective than vaccination? I guess my question would be A, is that accurate? And B, you talk about the vaccination and boosting rate sort of being like 30% for Omicron versus. Can you sort of explain how effective natural immunity is, especially against Omicron in similar terms?
So it's regarding the questions around Omicron and immunity, whether it's generated from previous infection versus immunity generated from vaccine and booster. In studies, what we have seen is after a natural infection, for about 90 days, you're considered immune by the CDC. So your chances of getting COVID at that time would be, it doesn't guarantee anything. Vaccine doesn't, immunity doesn't. But your odds of getting an infection in those 90 days are very, very low. As time goes on, that immunity is felt to wane, and the vaccinated and boosted immunity tends to persist much, much longer. And so to answer the question, is natural immunity versus vaccinated, which one's stronger? Your odds are better with a vaccinated immunity from getting COVID. That does not assure you will not get COVID. That simply means your odds are better. And the reality is there's different types of immunity. There's not one thing that gives you immunity. There's antibodies and there's other cells that help generate immunity. Antibodies are supposed to go down over time. If they all stayed there for a long time, we'd have too much protein circulating in our bloodstreams. And so that's common. You get infected, you have antibodies, the antibodies wane down. And that's the rationale behind boosting. So we get vaccinated, you generate antibodies, and then you get boosted to generate more antibodies because that's your best immunity. Otherwise, we have cells in the background that, if exposed to another illness, they will generate the antibodies in the response, but it takes a little bit of time. You may get ill during that time. So that's really what we're seeing, or the science behind why we're talking about natural immunity versus vaccinated and things like that. And it's really about what your odds are of getting infected or reinfected.
Dr. Willie, Dr. Basil clarified more than 200 patients in Avera are in the hospital system-wide right now with COVID. What are those numbers looking like for Sanford?
Yeah, with Sanford, for numbers of hospitalizations, so we were talking at noon today, and we share information regularly, share information with the state. So as a health system, Sanford is working with in excess of 200 patients actively hospitalized right now, and we put those numbers out in that slide, and we've actually taken that slide now to include those who are not vaccinated, those who are vaccinated, and those who are boosted. And our numbers are just like Avera's. We have no one with significant illness who has currently been vaccinated and boosted. Numbers for the state of South Dakota, we've been running between 50 and 70 actively isolated at Sanford on average. We're actually in the lower part of that number right now, but watching very closely. But that's what we've been working with.
Looking around here, we've had a lot of these. You mentioned sometimes the city's been here, sometimes the state. I would just ask you guys, or asking for the public's help, are you guys confident moving forward you can handle everything without the city and the state support, or is there anything you guys need more help from them? Would you be looking for that?
I would say we continue to appreciate and do receive quite a bit of support from both the city and the state. In fact, we just met with the acting secretary over the lunch hour, and we have routine meetings with them, and they have been incredibly helpful. Some of the testing struggles that we've been having, they really have stepped up to the plate and are working to get more home testing kits into our state. I think you'll see more movement on that. We continue to work with them about the very limited supplies of some of the therapeutics that we use, like Paxlovid and Sotrovimab, that they continue to act on our behalf on a federal level to try to get us each and every dose of those that we can. And so we absolutely continue to work and appreciate the partnership with them throughout that. One of the things I think is going to be positive coming out of this pandemic is the relationship between Sanford, Avera, Monument, the independent hospitals, the cities, and the state. Some of those public health relationships are something that have never been this tight and will serve our state and our region for years to come.
And I would just add a couple of comments there. I completely agree with that response. And then Dr. Chima with the city has been in very active communications with us. I was actually on the phone with a city councilwoman before I got here, and so that help has been very much appreciated. The VA has also been a wonderful partner to work with across the upper Midwest and Sioux Falls. We've had patients going back and forth, sharing best practices, learnings, communications. There's no secrets amongst us when it comes to dealing with the pandemic.
One final thing I had, you talked about the reliability of the at-home test for positive tests if you're symptomatic. If you have some cold symptoms or whatever, take it, it's negative. What are the recommendations there?
Right, so given the high level of disease that we have from COVID in our communities right now, the home test, a positive is 95% plus likelihood that you have COVID. There's no reason to retest, even if you had a negative test with PCR. I don't know that we would believe it necessary. So positive tests are very accurate in the setting that we're in. A negative test, the home tests have actually come a long ways from the early days, and they've gotten better and better. And so the home test negative is still probably 80–85%. And so, you still, there's influenza coming around right now. So if you're having symptoms of other things, you still probably should be staying home, even if it's not COVID. Now, in healthcare workers, that 15% likelihood that we missed it in that situation, we will, at least with the Avera employees, if they have a negative home test and they're symptomatic, we will repeat that in that setting. And so it kind of depends on the risk setting that you're in otherwise. I don't know if Sanford has a similar policy. Yep, he's nodding yes. Other questions? If not, on behalf of Dr. Wilde and Sanford, as well as Avera, thank you so much for helping us getting the word out to the public. We talk about healthcare heroes a lot. I think each and every one of us, the media is doing everything they can to help us save lives by getting out there and preventing illness, and so we thank you guys for what you do. The general public, there are so many people out there that are doing the little things each and every day to try to do what they can to help prevent the spread of this, and that is noticed and appreciated, and together we will get through this. Thank you.